There we go. Live
Good
from
morning.
good morning indeed. For
Good morning in the US. Good afternoon in Belgium.
yeah. Here it's 1 o'clock at your place in
And
Texas.
it's 6 a.m. here.
It's 6 a.m. So thank you very much for being at
Awake?
our being awake and also already being dressed up for our coffee break.
Thank you for having me, Jim.
Yeah, our pleasure to have you. For the people watching us today, we have Kellie O'Malley. It's like that. You pronounce it like that,
Yeah,
O'Malley.
like from Ireland, only from the US.
Yeah, and Kellie is a senior director of human resources in healthcare. Is that
Yeah.
correct?
Yes, it is.
Yeah. So, and that is what we want to talk about today, about America, about healthcare. So, first of all, please let us know, how are you doing?
I'm doing well. Thanks for asking. I think it's been a long couple of years in our workforce, and I have only been working in the healthcare field for a year and 2 months, roughly, after about 20 years in high tech. So it's been enlightening. So I am by no means an expert on healthcare, but I've had great observations of the challenges in healthcare that are so different than what I have seen in technology with software engineers and building products and just having companies that are product related versus in an industry that's taking care of people during a pandemic when we have a lot of overcrowding in hospitals and in nursing homes, and people are sicker and our caregivers are stressed out.
Yeah, yeah. What were the main challenges, like, apart from that? That the fact that, like, the pressure was like really high due to that pandemic. Or what were
Yeah,
the main
I
main
think
challenges?
I think overall burnout led to some high churn. Let's say you have 300 doctors and nurses in our company or a company, but you lose 98 of them in 1 year. And so that's a third of the company is churning and then backfilling and then having conversations with people after they're leaving, those exit interviews or the conversations, and just really in some ways, how can we save you, how can we fix this, how can we make it better, could we have done anything different? And a lot of people want more work-life balance, or they said the patient load was just a lot higher. Patients were a lot
Mhm.
sicker, dealing with chronic care, dealing with nursing homes, dealing with losing that many people in a day, day after day after day, and then patients by day, charting by night. Caregivers were exhausted overall, and then they have their family and their children, and they're just trying to juggle a lot. So I think that was the biggest complaint that I've seen in the last year is really tired and just too many patients, and the patients are sicker and the workload is harder. And then you've got coding, compliance and all the regulatory things for
Mhm.
funding. If you have Medicare and Medicaid in the US helping fund things, then there's lots of lots of work on the back end after taking care of patients by day, lots that the doctors or nurses have to document after taking care of the patients.
Yeah.
So I think that's really the biggest thing, complaint wise, that I've been hearing all year. Some people didn't want to be vaccinated and it became a mandate, so that was a thing.
Yeah.
And we were able to get, reasonable accommodations for religious reasons or for health reasons. But um, I think it's just the overall stress and that that it's gone on for 2 years.
Yeah.
I don't think and I think everyone was real strong and rallied for the first year. And then it just kept going.
Yeah. Yeah. And apart from that fatigue, were there just people like leaving because they didn't like to be in that healthcare sector anymore?
Um, from what I've understood, I think it was just overall burnout in the industry of feeling understaffed and just too many patients, and evaluating what they want to do next, just to have a better quality life with their family at home. And so being spread a little thin. I mean, honestly, I think what I saw in software and in technology is managers managing, having good quality one-on-ones, taking the time to listen to people, taking people's pulse once a week. How are you doing? Are you okay? And then listening.
Mhm.
I think in healthcare there isn't the same ratio. It's like you might have 40 or 50 caregivers and one person checking on them. So I think really just somebody doing the well check, like how do we care for the caregivers? How do we really take good care of them? Do we need to look at giving them more PTO? Do we need to look at making sure they have work-life balance? And I think they don't have as much, because I think in that industry, it's a productivity model, really driving how many patients you see. It's a high churn. It's a lot. Or a high volume of taking care of caregivers. But again, I'm not an expert. I've just been aware that, boy, we are losing people so quickly. And
Yeah,
so many are voluntary. And some, when I look at, let's say we lost 16 nurses in their first 3 months. So it's like happening quick. And then between 3 to 6 months, another 16. But then people that have been there over a year, we lost 50. And so I think it's surprising to me that in a field where you're taking care of patients, that it's hard. I think that's what maybe people need to realize. It's a hard industry for people, just to have the quality of life they want. And so they seem tired
yeah,
mostly.
yeah, yeah, yeah. And for sure, if you run a hospital as just like as a company, or yeah, then it becomes even harder. Now, you you worked in, like, yeah, tech IT, and you
Yeah.
worked in healthcare. It seems that you are looking for, like, really for the areas where a lack of people, or need of new people is there.
Yeah, I got really lucky. Software, 1998, I moved to Austin, started working with one of the best software companies there that I could have worked at in 1998. Some of the best and brightest from all over came there, and we grew from 100 to 1,600, and incredibly successful. So then my career path continued to be very people centric, people focused. What's the biggest need in the company? And really working with visionary CEOs on, sales needs help, go help sales. Marketing needs help, go help marketing.
Yeah,
HR needs help, put your head into HR. How do we bring the company together? How do we, and not traditional HR in the sense of just looking out at all the legal things, but more, how are we taking care of people? How do we have better, robust benefits? How do we give back? How do we make this the greatest place to work so that no one wants to leave? And
yeah,
so I was fortunate. Home Depot bought a company I was at, and I was with them for 6 years. We had less than 5% attrition. No one wanted to leave, but we really wrapped our arms around the people. It was
mhm,
like family, and people were supported, and put career path laddering and put managers in. And I think it's the quality of one-on-ones with, managers taking the time to just say, how are you? And people feeling like they have a safe place that they
yeah,
can talk. They can vent if they need to. And whatever they say under the red umbrella, that's what I used to say. Well, go have a conversation at the coffee shop and sit under the red umbrella, and it will stay. under the red umbrella, like your conversation is safe. And then a lot of times people just need support. So in healthcare, I think they're so busy going from person to person or patient to patient.
Mhm.
I don't I don't know how they do it, really, because I
Mhm.
don't think they have the one-on-one time
Yeah,
that I saw in technology that helped us keep people very happy.
yeah,
How
yeah.
is it in Europe, though?
Well, in Europe, it's the same. Like we have some people in the chat who are like responding like the situation in Belgium. It's the same. Like also, Michiel reacted like any workspace needs a space. So that's one thing. But yeah, in Belgium we see the same. Like healthcare is like really suffering. People, they are just tired now,
Yeah.
and in let's call it like in an organization, what we see is like, apart from the Great Resignation, what happened in America. So in America, 47 million people changed from employer. Now I don't know how many people are like working in America, but I think it's like at least 20% of the population that changed from employer. Now, what
Yeah.
we see in Belgium is that the turnover of employee was never as low as it was like during COVID, and the reason is, in Belgium, yeah, you are protected. Like the number of years you work in a company, you are protected by the unions, by a lot of like people are like kind of safe in their organization. Now, the moment that an unsafe situation as COVID pops up, then they rather prefer to stay in that organization. Why? In America you don't have that protection, and that might be one of the reasons why they were leaving. Now, another reason why it is like that difficult in healthcare might be what we saw, or what the study showed, was that 31% of the employees, they start coasting. So that means they just do the
The
minimum.
bare minimum.
They do the minimum, and I don't think it's possible. But you can tell me, like, can you do the minimum in healthcare? I don't think it's possible.
No, I don't think in healthcare you can. I think, you've got your patient load and, things surface quickly. I think on the operational side, it's really hard for like the managers that are very senior will have the tough conversations about performance with people pretty frequently. So if people aren't cutting it, they don't seem to last as long. So I don't think there's that much room to coast. Perhaps in the background with the support types, I don't know. I mean, one thing I was surprised about, Jim, is I felt like pay in healthcare, at least on the support staff, wasn't keeping up with how the cost of living has gone up. So some of the churn that you see, or some of the changes, or how many people are changing jobs, it's, if you're in an industry that's stuck and here's their ceiling and here's what their model is for salaries, and you're working with patients and you're drawing blood or you're doing this or that, but you could make more by working in a fast food place down the street.
Yeah.
And so really keeping up on our country, our cost of living has gone up so much in the last 2 years. At least here, I'm in Austin, Texas. So California, West Coast folks all have pretty much moved into Austin. So many companies have moved here. The cost of living's gone up higher. So if you're a caregiver working in a facility, maybe you're working transition to home and taking, helping patients in home, but you haven't had a raise in 8 or 9 years.
Mhm.
Well, then you might leave the industry to go work somewhere else because you just can't afford to keep doing it.
Yeah.
So I think, but when you're funded with Medicare, Medicaid, and certain things, and you have a fixed price, it's hard to move salaries up as high as what people might need them. So I think we're just in a time of like evaluating where we're at, evaluating compensation, making increases, really taking good care of people, looking at benefits. Are we doing as much as we can? And then really encouraging employees to prioritize their well-being. And reminding them like once a month or twice a month on, breathing and going for walks and nutrition. And are you sleeping? Do you get rest? And even I think covering talk time, that people have someone that they can talk to, like really encouraging the employee assistance program and encouraging overall wellness and burnout. So I think it's a harder field, though. I don't think the pay has gone up as much as it has in other industries. And I think the workload has gone up higher. So hoping things continue to get better.
Yeah. How would you revive engagement in healthcare?
Oh, I'm really big on if you've got a manager and you've got 50 people, putting in that next level so that people have someone really checking on them and doing one-on-ones. I think people need to be heard. How I would revise it is, can you have a weekly or a bi-weekly one-on-one, even for 15 minutes, and a good manager asking 15 questions and just listening and giving people time to just talk. And if you're too busy, we'll then put in 2 or 3 people underneath. Make time to hear people. I mean, that's what I would do. I just think there's a lot of people out there that they hit these breaking points and they don't know who to talk to. I think because maybe a manager is just overloaded and has 200 people or 150 people, and they don't really know how their folks are. Yeah. How else would I revise it? I would really evaluate work-life balance and time off. I would say people need more holidays. People need more than, 2 weeks of PTO time a year. People need time to take a wellness day. People need to call and say, hey, I need a break. I need a mental health day. I think mental health just can't be stigmatized as a bad thing, that people say, hey, I need a day of yoga and breathing and sitting by the water. I just need to take a break. So I think companies just really understanding that wellness is absolutely vital. If you have a healthy employee and a happy employee, then they'll help, take care of the people and take care of the company or the patients in this situation. And then they'll have the staying power if they're not burned out. Yeah, I think, because I think generally caregivers got into that profession because they wanted to help people. Yeah, that's their main purpose. Or their dad was a doctor and they decided to follow in his footsteps. But generally they want to help people, but you can't help anyone else if you're not, put the air mask on you, make sure you can breathe, and then you can help the other people breathe. And there I hear like let's call it the Claude Silver part in you. So really, you are a big fan of Claude. I think I love Claude Silver. I feel like I've known her forever. When I met her, I was like, oh, I feel related. Like I came from the same piece of cloth long ago, only she's done a lot with it. She's a great voice. And I reached out to her on LinkedIn 3 or 4 years ago, and she wrote back and said, I hope you're awesome. And I'm like, yes. And we just became, I don't know, she welcomes you into her world. And she's always there. If there's one person I follow, it's her. Yeah, that's for sure. Then you should come to our conference in June. Well, I have an Antwerp or bust. Like I have not given up hope. My passport is ready. I have looked up the flights. Yeah, very nice. I have asked my company if they can comp it, So I looked at the hotels. So I haven't given up hope. June 28th. Yeah. Good memory. Yeah. It's going to be a great day. And Claude's talking about belonging. Yeah. That'll be good. Yeah. Now for you personally, happiness at work, what does that mean? What do you need to be happy at work? Oh, for me, I think it's having a good rapport with who I roll up to, CEO, or and then really it's making a difference to the people. I don't like getting stuck in documents and papers and files and reporting. A good day for me or a good week for me is when I'm listening to people and when I'm helping people and when I'm solving problems, whether it's a manager or whether it's an employee just saying, "Can I talk to you?" Those are my best days where I'm able to listen, able to help, able to move it forward. And when I'm able to grow people around me,
Yeah,
where I'm very proud of seeing, seeing ones that start just new in the field of HR people, and then seeing them evolve and turn into strong leaders. So I love growing people and then helping people. So
yeah,
that's happiness at work for me, and those are the great days. And looking and being inspired. How do I pull a bigger company together? How do I help pull us all together? And how do I give back? But it's always relationships. It's the relationship building, whether it's those, whether it's managing up or managing down or across. It's the building that connective tissue
yeah,
to make the place better.
yeah. So all the bosses in healthcare, the advice is
The
just
advice is get other people to do one-on-ones. If you can't do it, check on your people, take their
yeah,
pulse either
yeah,
once a week or once every 2 weeks. Like, have a coffee. Don't just talk at them, listen. Just ask, how are you doing? Keep asking questions, see what they say.
yeah, yeah. So to the managers of the hospitals, please add more chief heart officers or chief ear officers.
Yeah, the listening
Yeah,
ones, listen to the heartbeats, make sure your heartbeats are all doing okay.
yeah. Okay. Thank you
Thanks,
very
Jim.
much, Kelly, for waking up
Yeah, you're welcome.
early.
Thanks. I'll have a really great day.
Yeah. Thank you for
You have a
being here.
great day there in
And
Belgium. I hope to see you in a few months.
yeah, we hope to
Okay.
see you there
All
also.
right. Thank
Thank
you. Bye
you.
bye.
Bye bye. Bye bye.